and a very good evening to all of you. I am back again with another episode of Homeo Mission 2026, which is in collaboration between Homeopathic 360 and Mission Homeopathy, Aditya Homeopathic Hospital and Research Center, Pune. And today we are going to join a very enriching live webinar with Dr. Sheetal Kumar Sonavde on a very interesting topic, a post-bypass renal challenge journey to the simillimum through a fascinating case study. Now, let me introduce our today's speaker. Dr. Sheetal Kumar Sonavde is a renowned classical homeopathy physician, professor, and educator with over 20 years of clinical experience, an expert in organon of medicines and homeopathic philosophy. He is dedicated to advancing clinical homeopathy through teaching, seminars, and his educational initiatives, including the Ghar Vapsi seminar series and the Beyond the Words YouTube channel. He has, as I said, 20-year plus clinical experience. He is MD in Organon of Medicines and received advanced clinical training under Dr. Amar Sinha Nikam sir at Aditya Homeopathic Hospital, successfully practicing classical homeopathy in Kopargaon, Maharashtra, currently serving as a professor in the Department of Organon and expert in Organon, and renowned speaker who has conducted seminars and educational programs across Maharashtra and Gujarat. Creator of the educational YouTube channel Beyond the Words and sharing lectures on organon philosophy, committed to promoting genuine classical homeopathy through education, clinical experience, and continuous professional development. And we are very inspired with Dr. Sheetal Kumar sir. And today we are going to learn about the post-bypass surgery. It is a very unique topic. Till now, we are going through this webinar series, and I hope all the attendees, all the doctors, and all the educators are very eager to learn from you, sir. A very warm welcome to you.
Thank you. Thank you very much, Dr. Mansi. Now it's already too late, 20 minutes late because of some technical glitch. Sorry for that, all audience. Now, without wasting much time on the introduction, I will go to the case. Just a second. It's a very interesting case of Is it visible? Yes, Dr. Mansi, my screen is visible.
Yes, it is.
Yes.
It is.
PPT is visible clearly.
So it is a very interesting case of a acute kidney injury or acute on chronic kidney injury in background of the coronary heart disease. It is a case of 62-year female patient. She approached me after a coronary heart disease and she had a CABG, means bypass surgery. After bypass surgery or during bypass surgery, she went into the coma because of the acute kidney injury, and the surgeons had to stop the surgery. And after 2 days, they again tried the procedure and they successfully completed the procedure after 2 days of the first failure. But after the surgery, the patient went into the chronic injury of the kidney, and her create values got increased up to the 4. And in allopathy, you know all that there is only one option remains behind, that is dialysis. But the patient has currently gone through a big procedure, so she was not willing to go for the dialysis, and she came to me for the complaints of chronic renal failure. At the time of consultation, the presenting complaints was operation filling in the chest, onset 1 month prior, associated with the nausea. So before the coronary symptoms or during the coronary symptoms, she had the oppressive feeling in the chest and associated with the nausea. So on investigation, she was diagnosed with the triple vessel disease. Acute kidney injury on chronic kidney disease. Her serum create was 94, serum creatine was 3.35, and blood urea level was 43. And on USG,
Yes,
both
it's
kidney
better
shows-
visible now. Okay, please continue.
Okay. The both kidney shows the raised cortical echogenicity, that is medial renal disease. So this was the presentation at the first history. And the chief complaints of the patient was pain in the site of the stitches on the chest, dry cough since 3 to 4 days, and disturbed sleep due to the cough. So very few symptoms, the presenting symptoms were very few, and the modalities were lying down, aggravation at night, and prolonged talking, better by sitting erect and drinking water. So patient came with the renal complaints, but very few symptoms at present. Only on the basis of the reports, we know that the patient is into the renal disease. So presenting complaints was only the chest complaint at the stitches because of the procedure, that is bypass grafting, and dry cough since 3 to 4 days, and disturbed sleep because of the cough. The complete investigation summary: cardiac ISD with the triple vessel disease, ejection factor was the 45, renal values as we saw, their creatine was 3.35, urea was 43, and urea was 94 and nitrogen was 43. And raised cortically echogenicity. Patient having the hypertension since 1 year and also diabetic since 2 years. The CABG performed 3 weeks back. Past and family history. Family history of the COVID vaccinations, 3 COVID vaccinations. Left-sided facial paralysis 7 years back, and with recurrence of the similar symptoms 2 years back. So patient had a history of left-sided facial paralysis twice 2 years back and 7 years back. Treated with allopathy and subsequently diagnosed with the diabetes and hypertension. So when she had a last attack of the paralysis, that time she was diagnosed with the diabetes mellitus and the hypertension. History of infertility due to the tubal block, surgery done 40 years back without success. So patient had a history of infertility and because of the tubal block. The cause is also necessary in such cases, and surgery was also done 40 years back, but still the problem of the infertility was not solved. The family history: mother had ischemic heart disease and 2 sisters had same ischemic heart disease. So patient has a strong family history of cardiac diseases. In physical generals, appetite was decreased after surgery, loss of taste, desire for the vegetables, sour, pickles and curd, aversion for the milk, intolerance, milk causes nausea, emulsion by the vomiting, thirst, small quantity, small interval, dryness of the throat. Tongue was deep crack in center, moist, indented tongue. Bowel was constipation, urine 2 times per day, once at night, sleep sound apart from the disturbance due to the cough. Perspiration was scanty. Physical generals. Thermals are: patient is towards hot, ambithermal and towards hot. This is the chart what I had taken the information from the patient about the thermal state. Menstrual history, menopause since 10 years. Previous cycles was very regular. Skin, multiple moles on the face. Dreams, many but cannot recall. And sometimes religious themes was there in the dream. Actually, the case is very few symptoms. Case had very few symptoms. Presenting symptoms are also very few. And even in past history, we only got that the facial paralysis and the tubal blockage. But in mentals, we got some points, nature and family and background. In the mental history, the patient childhood was very healthy relationships with the family members. But the financial condition of the patient was very poor. So she had begun to work, the manual work, since early age, at the age of 12 years, out of situational necessary rather than the compulsion. Married at the age of 14 and maintained a harmonious family environment thereafter. So patient is basically from the poor financial condition. She had taken responsibility of the work since the 12 year of her age, and she got married at the 14 year of the age, and also at the in-laws. She had a harmonious family environment, family space, husband, one adopted son, with and she was living with the husband, one adopted son, his wife, and two children, grandchildren. One of the four sisters and the three brothers, the fourth child, had no biological son, adopted her sister's son, whom she loves dearly. So, this is the case of the infertility. But she adopted her sister's son, and they are living happily as a family. Nature and temperament of the patient mixes easily with others, mild-mannered, soft-spoken patient of the silent nature, marked aversion to the quarrels. The patient is having very aversion to the quarrels, never experienced the anger. And she told me that she never expresses her anger, she never experiences the anger, likes to work all the time. She is very workaholic patient. She wants to work all the time, doing domestic as well as farm work. And one of the important point in the mentals as she is very religious, highly spiritual, and she completed the Wari, that is annual pilgrim visit. Now you all know this is the season of Wari. Now most of the people are going to the Pandharpur in this season, and she had completed the 9 Wari to Pandharpur 9 times, performs regular chanting and sings devotional bhajans. And she is fond of singing the bhajans and perform the regular chanting, jap, puja, जिसको हम बोलते हैं. So she is very religious person. She had a grief, but acceptance and the faith. No prolonged or the morbid grief, feels that Lord Panduranga has taken good care of everything. So she's a firm believer of the God, and she feels that the Lord has taken good care of everything. Grief witnessed the death of the mother and the two sisters, but views as a natural progression of the age. So no prolonged or the morbid grief in this case. Anxiety, not such anxiety. She manages stress with the philosophical outlook, simply surrendering to the circumstances. She surrenders everything to the God. In her talks, she constantly tells that the Lord Panduranga will take care of everything. So there is no much anxiety. There is surrenderance to the God. Quarrels, dislike conflicts, avoid to quarrels within family or outside the family also. Contentment. She was very contented. When I asked her about what grief in the life or what are the things you feel that left in the life, so she tell me that she is very contented. She don't have any expectation from the life. She's very happily living in this life, and deeply satisfied with the life anger never expressed. And she was very caring and loving for her family and the relatives. Only fear I found that the fear of the thunderstorm. Hobbies enjoys the singing of the devotional bhajans, devotional songs of the God. Loves silence and the peaceful environment. She loves silence and the peaceful environment. Emotional expression, prone to weep when meeting to close acquaintance or witnessing someone else in the distress. Can cry openly in front of others. Markedly admiration by the consolation. Overall, a highly supportive, caring, protective nature towards everyone around her. As I told you, she was very loving, caring mother of the family, and she also very supportive and protective for the all family members and the relatives. So this is the main crux of the patient, the mental as well as physical symptoms of the patient. So as I told that the she was a very religious person, doing worry, surrender to the circumstances, singing the bhajans, never experienced the angers. God has taken care of the everything. So this is the picture of the patient, the physical as well as the emotional picture and the spiritual picture I have put in forth. So now it's your turn. What its totality and what comes in your mind after seeing these symptoms of the patient. Now try to make a totality and find out the remedy. I know it is very difficult to find the totality in such cases where complaints are very few. In this case, there are very few complaints. The patient only has the dry cough and the disturbed sleep. But the pathology of the patient is very deep. She had the coronary artery disease as well as the renal failure. So the pathology is deep, but the presenting symptoms are very few in this patient. But we have a rich mental symptoms in this patient or the rich spiritual symptoms in this patient. No. So try to find out the totality and the remedy. I have given the clue for you all. Now it's your turn. Yes,
Yes,
Doctor.
I can see. Yes, I can see many are typing in the Q&A. Wonderful totality options. So please, everyone, be active. It is a very, very different and highly pathological case. It's not our day-to-day case. And to learn the most, please participate. Dr. Sheetal, the
Yes,
options they are showing is oblique sac. What is this remedy? I don't know. Then totality by Dr. Nilofer Kaskar. Mildness, containment, religious, operation feeling in the chest, hot patient and desire SAR.
okay.
Okay. Others also please do participate. There are almost 200. We are reaching at the count of 200. That's really wonderful. Lachesis by Abhishek Mahale.
Dr. Nilofer had given the wonderful totality. Now try for the remedy. Dr. Abhishek, why it is lachesis? Please try to elaborate the totality.
Yes, the next option coming from Dr. Archana. Please write few lines if you are prompting the remedy. Remedy prompted by Dr. Archana is Aurum Med.
Okay. Well try, Dr. Archana. Please try to elaborate and try to give the totality of the symptoms or the rubrics or the theme of the. It is
Yes.
not necessary that every time you can catch the rubric, you can also catch the theme of the patient. So you can please try to explain why lachesis,
Natramur
why
is written by
Aramet.
Suvana. Natramur is option given by Sugam.
Natramur. Yes, Dr. Sugam, please try to give the explanation why Natramur.
Yes, one total is coming from Dr. Vidya M. Cause, grief, nausea, dry cough, disturbed sleep, left-sided paralysis, religious, infertility. Dr. Vidya also write the remedy. Dr. Kailas has given explanation of aurum that patient is cool, no angry, so and religious, so natramur. Sorry, aurum mate.
Okay. Very good, Dr. Kailas.
Nivedita Staphylococcus aureus or Hyoscyamus.
Nivedita, please try to explain why Stapes aureus or why you think that is Alzheimer's.
Dr. Suvarna has come with nice totality that is
Dr.
chest
Vidya had
operation.
given the nice totality. Cause is grief, nausea, dry cough, left-sided facial paralysis. Try infertility. Dr. Vidya, try for the remedy. Dr. Suvarna also gave the nice totality. Responsibility, sense of too much, industrious, religious affection. Very good rubric selections, Dr. Suvarna. Dr. Nitin is with content, religious, work desire for thermal hot, carcinosin. Okay. Aurum metallicum. Ipecac, Alzheimer's. Okay. Yes, Dr. Abhishek, left-sided, religious, operation of the chest, cough at night, soleacasis. Okay. Content, religious, affectionate, milk aggression, natrum calm. Okay, well try, Dr. Gajanan, Dr. Abhishek. Most of the participants are close to the remedy. 2, 3 participants are close to the remedy.
So everybody is eager to know whether someone has tried the remedy or not, Dr. Sheetal, or it is yet to trust, match.
Few of them cracked half of the remedy.
Okay, that's going very interesting. Everyone, please put your efforts. Almost 200 are there.
Yes.
Some new options are
Two
coming
or
like,
three people are up to the 50% of the remedy.
okay, great. So there is one interesting quote that is antipsychotic remedy as there is history of tubal blockage. Any comment, Dr.
Yeah.
Sheetal, on this?
She is in this phase since her puberty or since her marriage because tubal blockage was there and the same pathology is continuing to the coronary artery blockage. I forget to show the symptoms, the reports of the case. She had 7 blockages. Let me show you the
Yes, please.
report.
Without revealing remedy, please. Everybody is very excited to know.
Yes, I had already added to the PPT, but don't know why they're not appearing. Okay. Okay, I will show at the end of the session because if I stop I have to open the another PPT.
Okay. So please have once again look at the chat box. Many are
Okay.
trying at their best.
Dr. Megha Patil, Aurum neonatum. Why Aurum neonatum, Dr. Megha? The patient seems very positive towards life. Then how come she has psychotic miasm? May I know, please? Okay. Aurum neonatum. Okay. Naja, arsinosin, pulsatilla.
While saying that, please show previous slides again.
Okay. If you want to see the previous slides, I am replaying the previous slides.
Yes, that will be better.
Complete investigation, then past and family history. These are the physical generals. These are the mental symptoms of the patient since childhood. Yes. Any more comment, Dr. Rahul?
Yes, I'm keeping eye on this section. There are very interesting combinations like aurum, sulf, pulsatilla, phosphorus, pulsatilla, hyoscyamus, pulsatilla. One is asking, is there any repression? Any comment?
No, there is no any repression, or she is very optimistic. She is taking life as
It comes.
uh,
Yes.
she's having very good relation with the family. She's very optimistic. She maintains the relation with all. She's very loving and caring for all our family members and the relatives. And she's very religious, doing her jap and the reading of the religious regularly. Even she went to the Pandharpur for 9 times in Wari. So very clear cut mental symptoms, or the spiritual symptom. We can say the spiritual symptoms of the case.
Cocculus, McCarp, carcinosine are coming again and again.
Okay. Let's see the follow-up
Yes, please.
and the investigation of the patient. So this is the investigation when she came first to the me 3.35, and before this report she had a creatine about 4, but the report was in the previous submitted in the previous hospital, so I don't have the first report of the patient where the creatine was the 4, then 3.35, then after the remedy it come down to the 2.57, and within a month it came down to the 1.78. So this is the last time she reported 1.78. Let's see the follow-up video of the patient. Is it audible, Dr. Rahul?
Clearly visible. Audio is yes, yes, it is audible.
Okay.
Okay.
जेव्हा ऑपरेशनला गेलो ना तेव्हा डॉक्टरने सांगितलं पेट व्यवस्थित होईल तर मला काही समजलं नाही काही त्रास आहे ना तिथून पुढे मग सुरू झालं तेव्हा काहीच नाही
तेव्हा डॉक्टरांनी सांगितलं तेव्हा काय त्रास झाला?
त्यांनी सांगितलं बा तू पेट व्यवस्थित होईल ऑपरेशन थांबवणार त्याने 2 दिवस गोळ्या औषध दिले औषध केलं नंतर सूज कमी झाली मग ऑपरेशन झालं.
अच्छा.
त्याचं ऑपरेशन झाल्यानंतर मग आम्ही त्या गोळ्या घेतल्याच नाही जर काय दिले असते ते त्या नंतर घेतल्या तुमच्याच गोळ्या चालतात.
अच्छा. आता कसं आहे?
आता चांगलं काही त्रास बिरास काही नाही
काहीच नाही. जेवण वगैरे सगळं व्यवस्थित झालं?
सगळं
लगुला वगैरे त्रास काही?
नाही.
काहीच. झोप येते चांगली?
हा.
परत ते किडनीचा काही त्रास नाही?
असं तर नाही त्रास नाही.
काही नाही.
आणि पुढचं नाही सांगतो
ते डॉक्टर काय म्हणले होते
मग ते
आता तुम्ही गेले फॉलोअपला तर?
ते म्हणे ते कस काय रिझल्ट आला इथं नाही आला तिथं कस काय आला तिथेच करा
So if
अच्छा.
possible, can you translate the lines?
हम्म.
त्यांना विचारलं म्हणलं असे असे डॉक्टर आहे त्यांची म्हणते किडनीच रेट कमी करायला घेऊ शकतो का
हम्म.
ते म्हणजे घेऊ शकतात असं काय गोळ्या घ्या फक्त त्यांनी हृदयावरच्या गोळ्या घ्या त्या बंद करू नका ते म्हणून
हम्म.
तुम्ही ते रेट कमी करायला घेऊ शकता गोळ्या
गोळी दिली फक्त त्यांनी हृदयावरचे
हा.
बाकी तुमच्याच गोळ्या
शुगरच्या
One thing I want to highlight here that even the allopathic doctor or the doctor who had done her operation is promoting the homeopathy. That he tells them that don't stop the homeopathic treatment. You have a very beautiful result of this pathy. Your creating came from 3.5 to 1.7. So continue that medicine without failing. So it is very proud moment for the homeopathy that these cardiologists are also suggesting to continue the homeopathic treatment.
पातळच्या गोळ्या मला पहिल्यापासून
हम्म.
त्या जाणवता ना
हम्म.
गोळ्याच्या गोळ्या चालू आहेत
अच्छा.
पण किरेट बार 4 वर गेलो होते ऑपरेशनच्या वेळेस
हा.
तुमच्या गोळ्या घेतल्यामध्ये म्हणजे पूर्ण 1.78 वर आलं
हा.
ते का 100% 101% रिझल्ट तुमच्या याचा भेटला मला
हम्म.
Can you translate this line?
आज
What
एकदा परत
this
चेक करून
man
घ्या
said?
result.
So the first create level was 4, and after the 1.5 month treatment, the reports came to the 1.78.
Oh, that's really interesting and amazing.
So the remedies. Anyone
Okay,
want
sir.
to try? Last try for the remedy. Arsenocin pulsatilla, aurum, natrum mur, natrum carb. Okay. This is the repertorization sheet. The patient is industrious, quarreling aversion to, contented, religious affection, responsibility, strong sense, and heart disease, that is arteriosclerosis. The remedy in repertorization is aurum metallicum, but the final remedy is not aurum metallicum.
Okay.
Only one person cracked the remedy, aurum mur. The remedy was aurum mur. Very interesting case. Now let's see why aurum mur. Why I added the muriatic element in this case. So aurum muriaticum from Ian Shelton, element theory. Aurum are the most responsible persons, conservative, protector of the family, then guardian, shepherd, and muriatic element is the mother and child, caring and nurturing nature. She was very caring and nurturing as a mother. You can see that she do not have her own son, but she adopted a son of her sister, and they are living very happily as a family since last 40 years. So the caring, nurturing mother, her character of caring, nurturing was reflecting from her behavior. Another group is analysis from the Ian Shelton, very responsible as a mother, heavy task as a mother, responsibility, queen mother, leadership, nurturing, protective towards one's mother, a protective mother. In the Philip Bailey, a homeopathic psychology book, the Philip clearly mentioned about the aurum, that aurum learns early to be independent, to rely on nobody but himself, and to show no signs of weakness. So in her case, she started working at the age of 12, and she had early responsibility as she got married at the 14th year of the age. She was very workaholic, typical aurum takes few holidays and is likely to spend half his holiday working. So according to Philip Bailey, the aurum is very workaholic, and Aram seldom loses his temper. More often, he bottles his anger inside. So her anger never, or she don't feel angry in it. She had no experience of the anger. Means there is a strong element of the Aram in that lady. According to the Soul of Remedies by Dr. Shankaran sir, the Aram is the feeling that person must perform the task which is impossible or much beyond his capacity. He demand of himself industry and responsibility. So Aram are very responsible persons. They are very restless person, industrious person, workaholic persons. And one more thing I want to focus from the Soul of Remedies, that the patient usually relieved by the music. One of my early observations, Dr. Shankaran wrote in his book, Soul of Remedies, that Aram patients like to hear bhajans. Bhajans are the Indian religious songs which are sung with the exact meter and with a lot of devotion. So she is a devotee of Panduranga. She likes to hear the bhajans. She likes to sing the bhajans. So this theme matches her exactly about the music. Dr. Shankaran sir further explained about the three components: religiousness, musicalness, and exactness. And he found that in combination, only Aram and the Aram persons are the most people I have found to be markedly ameliorated from hearing bhajans, or in this case, she is singing bhajans. And physically, Aram patients tend to develop the serious chronic problems such as hypertension, heart disease, destructive pathologies. The hair kidney failure is a destructive pathology in this case. So I think you got the complete picture of the aurum metallicum, aurum muraticum. Why muraticum? So now as a organon teacher, I want to explain this case on the three planes. Usually what happens when patient comes to us, we usually take the detailed history of the patient. But nowadays, most of the people are seeking for the shortcuts. But there is no shortcut in homeopathy. We have to take the detailed history of the patient. We have to check the symptoms on the every plane of the patient. Every plane means spiritual plane, mental plane, and the physical plane or the body. As a life is a trinity of life, life is made up of the spirit, mind, and the body. We have to develop the vision to look for the symptoms on all three planes. In this case, the spiritual symptoms were her contentment, acceptance, that her divine devotional nature, her surrender, these are all her spiritual symptoms. And all in this case, the spiritual symptoms are strong indicator of the remedy. So in every case, we got the different types of symptoms. In some cases, we got the spiritual symptoms. In some cases, we get the mental symptoms strong. In some cases, physical symptoms, modality strongly. So we should decide our remedy on the basis of the trinity of the symptoms, or when we complete the case by taking the symptoms from all the planes of the patient, not only on the one plane of the patient. In this case, the mind symptoms were early responsibility, highly responsible, well-behaved, well-mannered person, weeping, nurturing, caring. These are all fear of thunderstorm. These are all the symptoms of the mental plane of the patient. And very interestingly, the physical plane or the pathological symptoms of the case. So these are all the physical general symptoms, but the main pathological symptoms or the pathological correspondence in this case was the which is also the symptoms of the aurum, where there is a affinity of the vascular system, arterial walls, and the heart muscles characterized by the high pressure structural degeneration. So ischemic heart disease with triple vessel disease, aurum is one of the premium remedies for the advanced structural arterial blockage, arteriosclerosis, and the myocardial ischemia. So once you take a complete case, we can correlate all the three plane symptoms in a single remedy. So one of one more point, why muriaticum? Where the muriatic element reflect in this case. The orums affect the organ of the duty, and muriaticum element introduce a deep affinity for the fluid balance, mucous membranes, and advanced kidney elimination failure. So in this case, the fluid balance and the mucous membrane and the kidney elimination failure leads to the muriatic element of the case. Acute kidney injury on the chronic kidney disease. The aurum muriaticum is classically indicated for the severe parenchymal renal degeneration, interstitial nephritis, and the cases where heart failure leads to the secondary kidney failure. One more point for the muriaticum, that frequent thirst and the dryness of the throat. Patient have a small quantity and small interval thirst with the dryness of the throat. The muriatic element governs the severe fluid disturbance. So why there is dryness and why there is thirst? Because of the fluid disturbance, producing a characteristic picture of intense dryness of membrane and the high demand for the water intake. So, and patient also have the marked intolerance of the milk, which is a very common symptom of the muriatic. In muriatics, most of the muriatic patient, we can find that there is a milk intolerance. So on the physical plane and as well as the mental plane, as well as the spiritual plane, the aurum metallicum fits well in this patient. That's why I selected the aurum muriaticum and given the 30 potency. I have repeated the dose once 15 days because patient, I usually call the patient for the follow-up every 15 days. So repeated few doses of the aurum muriaticum, and the patient is now living the very stable life without any kidney symptoms. So what this case does not show. We usually get prejudiced, especially new students get prejudiced about the aurum, have the prejudice about the aurum, that aurum should have the disgust of life, aurum should have the suicidal tendencies. So in this case, the prominent symptoms, that disgust of the life and the suicidal disposition, both are absent in this case. But as an organ teacher, I want to tell you that don't be prejudiced at the time of remedy selection. That every aurum patient should not have the suicidal tendency. Some aurum patients are also very optimistic. In some patients, you find the very religious symptoms. In some patients, you got the very optimistic picture. So don't be prejudiced at the time of the prescription, or don't skip such remedies because there is no key symptoms in the case. So you have to make sure that the remedy should work on the three planes of the patient. So thank you very much for patience listening. And if you have some queries regarding this case or regarding my explanation about the aurum muriaticum, you can ask me freely. Yes, Dr. Raul, is there any questions?
Yes, the session is going very interesting and very smooth. There are questions as usual about, first of all, the question was aurum is more closely related to which remedy? It is by Dr. Muhammad Hamas.
Mm-hmm.
Which remedy is closely related with the aurum?
Okay, aurum is very closely related with the responsible remedies. Aurum
All
is very
responsible,
closely
yes.
related with the optimistic and the ambitious remedies. So Nux vomica is one of the close remedy for the aurum. Natrum mori is also one of the close remedy for the aurum because discipline and responsibility taking capacity. Carcinosin is also very close. Some people have mentioned the carcinosin. Also, Kali family is also very closely related with the aurum.
Okay,
And
then
yes,
Then of course, with our each session, the same question comes about the potency and repetition. So from your wide experience, can you share which potency work for best for you and why?
Okay. As we have a experience about the 30 potency, 30 potency is a very, as per our mentor, Dr. Amartya Nikam sir, and also we had experience in our practice. Now I'm practicing since 20 years as a classical practitioner. I have also experienced that 30 is a very safe potency. We do not see any aggravation in 30 potency or very few aggravations in very hypersensitive cases. But in most of the 99% cases, we don't see any aggravation. We can easily repeat the dose in 30 potency whenever necessary. What happens in higher potencies? We have to wait for the long period. And what happens in the lower potencies? If you repeat it frequently, there may be the appearance of the accessory symptoms of the case. That's why we are choosing the medium potency, not so high potency, not too low potency. 30 is a very medium potency. And in 30th potency, as per the Dr. Henneman, most of our remedies are had to be proved into the 30 potency. And most of the remedies are proved into the 30 potency. Because in 30 potency, physical as well as mental and spiritual symptoms, all three planes of the this 30 potency acts on the all three planes of the patient. And so we had in Matra Medica all the symptoms from the three planes of the patient, from the spiritual, mental, as well as the physical plane. That's why we are using frequently 30 potency.
Yes, this is very much clear. Now, Dr. Sheetal, first of all, you have given fantastic correlation with the pathology. That is very
Yes.
unique. So we have heard that you have a lot of doing work on the organon and about some organon lectures. So for all of us, for all of attendees, which are still more than 175, please tell me something about your work on organon.
Yes, nowadays I am working as a professor in organon department. What actually I found that most of the students are not having the clear basics of the organon. That's why there is failure in practice the homeopathy. So most of the students are get diverted to the other mode of treatments and the easiest way for the earning. But homeopathy is not so difficult as today generation feels it is very difficult. But the main problem is they do not understand the basic concept of the organon, the basic concept of the philosophy. That's why I had started a series on the YouTube also about now recently I had posted most of the lectures of the Robert, and you can also get very deep idea of the philosophy in easy language on my channel Beyond the Words. And I'm going to post about the Kent philosophy. I'm going to post about the chronic diseases by the Hahnemann, even all the aphorisms of the sixth edition. I have to made some. I had made
Sorry
some
to interrupt.
videos.
Can you play the slide? Can you play the slide in which your YouTube channel and all was shown so that everybody can have access to this?
Okay, just a minute.
Because this is very interesting and this topic usually we don't get on the YouTube in such a practical way. Yes, the questions are already coming. Please tell about your YouTube channel. Philosophy channels are very few, and learning this philosophy from the experienced practitioner like Dr. Sheetal Kumar is a real learning feast, because we just monotonously keep on either learning philosophy from the teacher, who unfortunately many times don't practice. But you have taken this initiative.
One is asking, please suggest some books which has shaped your understanding.
Someone is asking about my books. I had not written any book yet, but
Any books,
I am
which has
using
helped you?
books. Actually, my understanding of the disease and the pathology and all these planes is I had learned all these things from the Aditya Hospital from my mentor Dr. Amartya Nikam sir. And as my mentor Dr. Amartya Nikam always says, follow only Dr. Samuel Hahnemann. I am also following this Hahnemann sir, and I have practically experienced all these organon and the philosophical topics in the Aditya Hospital because I had spent 2 years in the Aditya Hospital and learn all these things with Dr. Amartya Nikam sir. So you can also join there and you can see the live Mater Medica, you can see the live organon in the Aditya Hospital. And also, if you want to learn more about the philosophy and organon, you should read the authentic, means the original source book. Don't go for the shortcut books or the notes that is available in the market. Go for original books, original source. Read the 6th edition of your own, and you can find that there is a solution of every question. When you are in doubt, go into the 6th edition. You will find all answers there. So I personally feel that the 6th edition is the complete book. There is no any incompletion in the 6th edition. Whenever I found some difficulty in practice, I go to the 6th edition, I read the 6th edition, and I get the answer in the 6th edition itself.
That's very important practical suggestions. Now we are looking forward for your YouTube channel. The questions are coming. Is it?
I cannot find the slide. I had made the slide.
Yes, yes, I can remember that you have made a very beautiful slide. I'll check
Chat
from my
box
side also.
Dr. Priti will put the link in the chat box.
Yes, please put link, or you can also put your contact number, so anyone can approach you. Write the name and number in the chat box.
Okay, sir. So Dr. Sheetal Kumar sir has shared a very nice presentation. Any other questions we have left?
Yes, please ask if any questions you want. Yeah, any difficulty in this case or regarding the case taking or regarding the organon. We can have the special organon session if 360 permits us. We can have the special organon session where we can learn the most concepts of the organon, which are very difficult to understand as a student.
So definitely, we are very happy to hear about your other platforms, and that's very nice that you share your clinical experience and your knowledge beyond your college also. So that's very impressive. And for the YouTube channel link, we will definitely add this video in the collaboration with the Dr. Sheetal Kumar sir's YouTube channel.
Thank you very much, Dr. Mansi.
And I guess we have covered a lot of questions, and it's time to wrap up. In the end, I would like to say that these sessions are like gems, and every Friday we are learning from very passionate doctors. Most of them are from Pune and other states. So sharing their knowledge with us in a very simple and a very easy and clinical way, it is very impressive. So
thank you
again.
Dr. Mansi.
Thank you, sir, for taking your valuable time for us. And it's time to say goodbye to all of you with the all due support of Dr. Rahul sir. Thank you so much for making this session successful.
ending it with 2 lines that Dr. Sheetal's session was very unique in the sense that it was a deep pathological case
Yes.
and he has correlated well with pathology and mind together, which is very unique, and organon. So all those who are still present, more than 150 here.